Thank you very much, Director of Press, Office of the Secretary to the Government of Nigeria. Distinguished ladies and gentlemen of the press, I want to once again welcome you to the National Strategic Cold Store of the National Primary Healthcare Development Agency, which is an agency under the Federal Ministry of Health. As you earlier observed, we do have up to 3 ultra cold chain equipment that are fully functional in good working condition. These ultra cold chain equipment each have a capacity of 700 liters. So total capacity available to store the Pfizer-BioNTech vaccine is 2,100 liters. For the first 100,000 doses of the Pfizer vaccine that we're going to be receiving by the end of this month or early February, the total requirement is 500 liters. So we have more than required capacity. So some of the information going out there that we do not have the capacity to store the 100,000 doses is not correct. So today's visit is really to demonstrate the availability of the ultra cold chain equipment and to emphasize the fact that we're working together with our development partners to roll out a comprehensive deployment plan that will ensure that we leverage on the experiences of the polio eradication program, all of the really amazing work that Nigerians have done, the frontline health workers that helped us to get Nigeria and Africa certified as wild polio virus free just last year. All of that effort will be tapped into towards the deployment of COVID-19 vaccine. We understand and acknowledge that it's not exactly the same vaccine, different scenarios, but the same types of principles around coordination, micro-planning, trainings, building capacity, community engagement. Those are the same principles that will help us be successful. Only last year we had, in October actually of last year, we had a campaign that reached 23 million kids under 5 years of age. So that gives us confidence that we'll be able to reach Nigerians over the course of the next 2 years, up to 70% of Nigerians. However, we are mindful that this has to be predicated on real-time issues. For example, the vaccines are not even here yet, so you cannot start the countdown until we have the vaccines. The first tranche of vaccines will be coming by the end of January or early February, right? 100,000 doses is just a drop in the ocean. It's not anywhere near what we require, right? So the clock starts ticking when we have those quantities of vaccines that we can actually begin to make a huge dent in terms of coverage of Nigerians. We're also mindful that we still have to do a lot of work to overcome the vaccine hesitancy that we're already seeing, the misinformation, the conspiracy theories around the COVID-19 vaccines. And we do not take for granted that all Nigerians understand the principles around vaccine production. That is why we know we have to do the hard work. It's not enough for us to offer the vaccines to Nigerians. We also have to do the hard work of sharing information, educating Nigerians about the vaccines, how they were produced, the facts that they are safe, and all of the measures that the Presidential Task Force, the Federal Ministry of Health, and National Primary Healthcare Development Agency, working with the NCDC and other line ministries, are doing to make sure that NAFDAC certifies that these vaccines are safe and effective before they will be deployed. No vaccines will be administered to any Nigerian without NAFDAC, the regulatory organization, certifying that they've gone through all of the dossier, they've done the necessary tests, and they can confirm using reliance mechanisms, using WHO data to say yes, these vaccines are safe for Nigerians. I want to reiterate that the responsibility of taking that decision to to vaccinate Nigerians is the responsibility of government. It is a sacred trust that we do not take for granted. It is something that we're going to be doing very diligently. But we know that all those concerns that are being raised are not just out of mischief. It's because people don't understand. So we are going to continue to work hard. We're going to be working with traditional leaders, educating them, because they are the gatekeepers of the communities. They understand how to communicate. Our religious leaders, our community-based organizations, opinion leaders, political leaders, because they are the representatives of the people, and they can communicate even better than ourselves, right, around how safe the vaccines are and what we have done to make sure that all the boxes are checked when it comes to making sure that Nigerians have access to these vaccines. But working with our partners also, we want to make sure that the processes, the logistics, the operations that are required to get to the last mile are actually taken care of. We do not take for granted that this is going to be an easy task. We know that difficult days are ahead, but we also know that this is a responsibility. And drawing on our lessons of the past, we want to succeed. And this is why everybody has to be on deck, must have all hands on deck to make sure that we deliver these vaccines despite all of the challenges that we will be facing. So thank you very much for all of the questions that you've raised, all of the work that the media is doing. We are all in this together. I like to say that we're one team, we're one Nigeria, and we have to focus on how we can deliver the vaccines to all Nigerians so that all Nigerians will be protected, so that we can once and for all eradicate this disease. Eradicating this disease means eradicating disease globally, not in just one community, not in just one country. It is a question of making sure that as one global community, we're able to ensure fair and equitable access to the vaccine. As we all know, the virus does not know borders. It doesn't know Nigeria from Cameroon or the Benin Republic or United States. It just flows across the lines of least resistance. So we must work together as small communities, as states, as local governments to make sure that we eradicate this virus. Countries have to collaborate together to make sure that it's not a disease that is left for only Africans because we don't have the vaccines. We have to work together to make sure that the vaccines are also available to Africans, to low and middle income countries, just as the developed countries have been able to procure them. It is only when we're able to do that that we will eradicate the virus globally. There's no such thing as a partial eradication. We can only talk about total eradication, and it's in working together that we can quickly stop this pandemic. So thank you very much.
Thank you.